Welcome to Business Connection. I'm Liz Spencer. Today we're on location at the Edward-Elmhurst Health Center and Immediate Care to learn about the services offered and how they can help. Thanks for joining me. Dr. Schubel, give me a little overview of this facility that we're in right now.
Right, so this is an immediate care, Edward Immediate Care. This is our third facility in the area. We have a similar location in Bolingbrook and another one in Oswego. So we've been only open for a couple of weeks. We're hoping to serve this part of town a little bit better for our Edward folks on this side of town.
Is that why this location, that be more
Yeah,
north?
that's certainly part of it, is that we don't have a location for immediate care on this side of town, so it allows people to be closer to home. It's also right by the highway, easy access to give people an opportunity to check in when it's convenient for them, which is what we're trying to provide.
Tell me a little bit about what you mean by immediate care. I think we often don't know what type of care we need.
Yeah, I think it gets confusing because there's a lot of different levels of care you can go to. We have our walk-in clinics, the dual-based clinics, and we have the ER, and this fills the interim in between that. So in immediate care, we have a lot of different things we can do. There's here we have X-rays, we have some lab stuff, we can do EKGs. Generally serve minor care type things like sore throats and sinusitis, cuts and bruises, broken bones. We do orthopedic things here as well. We'd encourage somebody that's having chest pain or more serious symptoms just to go directly to the ER. But for in between, this is a perfect spot.
And when you say in between, is this somebody who might be in between a doctor? Like I think everybody's always encouraged to have a family doctor.
Sure.
Where does the immediate care fall into that?
Right. Well, I think often people can get in to see their family doctor. There's either off hours or times where that's not available, and then when they need urgent, immediate attention. Sometimes the accidents and injuries happen at the worst of times. So we're always open and available to help. We'll always try to, if you don't have a doctor, set you up with one. When you leave here, if that's what you need. But any acute stuff that this is the most convenient place for you, we'd be happy to help you.
Right. It always seems like we need to go to the doctor and it's late at night or later at night, past office hours, or we wait too long and all this kind of stuff. So. Right. So this is immediate care. I think we often hesitate too on when to go to the ER, and you mentioned chest pain, but take me through some more decision making there.
Right, I think sometimes it is hard to know the exact right place. We are all in the same system is what I would say. We'd encourage people that have chest pain, significant shortness of breath, weakness, severe dizziness, things like that probably are going to need the resources we have at the emergency room. We have people that make the mistake and walk into the wrong place, and we can help you get to the right place quickly and safely if that's the case. So we'd always encourage you to try to be the right place to begin with, but we have all our docs are board certified; they can handle emergencies if need be. So it is sometimes difficult, but chest pain, stroke, very significant shortness of breath, significant belly pain, things like that probably are best served at the emergency department.
You just tell us to kind of trust our instincts.
Sometimes, yes. So you can always call and get advice either from your physician or even here if need be to help locate where you probably should go. But we encourage, if you're feeling sick, really sick, 911 is always the best answer.
Tell me a little bit about who's providing care here.
Sure. So at our immediate cares, we have a combination of both board-certified emergency physicians and family practice docs. So there always will be a physician at the immediate cares. We do have, not at this site yet, but at our other sites we use some PA, nurse practitioner coverage along with a physician, but there's always a physician there working as well. And in the ERs, usually ER docs, the minute clinics, the walk-in clinics tend to be more either physician assistants and nurse practitioners.
Well, and either way, at the immediate care, it sounds like that word immediate, it means I might get in and out a little quicker.
Well, one of our chief metrics that we look at is time to provider. Our goal is to keep it in the system under 10 minutes. So by the time you walk into the triage desk you're in front of the provider, 10 minutes is our goal on average. And we're right around there. At our other sites, we'll be higher than that. Easier in here because we're just getting open. But that, even when we get busy, that's where we like to be.
Dr. Schubel, thanks for taking time out of your busy schedule.
Thanks for having me.
I am confident no matter what care facility I choose for Edward-Elmhurst Health Center that I'm going to be in great hands.
I think
Thank
you
you so much.
All right. Thank you.
Dr. Bhat, thanks for joining me.
You're welcome.
You're from the Edward Medical Group. Tell me a little bit about your practice.
Okay, we're a group of 4 providers. There's myself, there's Dr. Barbara Emery-Stolzer, and then we have a physician assistant, Ruchi Balaney, with us too. We actually just moved over to this location. We were located in Lyle, not too far from here, maybe about a mile or so. So yeah, we're liking our new location, and it's nice to be right next to the immediate care. We're all internists in our practice, and we're happy to see any adults that want to come in.
Now we hear internists or internal medicine doctors, and we often wonder how they differ from the family medicine doctor. Can you give me a little insight?
Sure. So internists tend to be adult doctors. So we don't usually see kids. We don't usually do maternity care. But we will see adolescents, so usually above the age of 16, you can schedule a visit with an internist, and any adults or elderly care. We do comprehensive acute or chronic care. We do preventive medicine. So that's the main difference, is that family physicians will see kids, and they also do maternity care, which internists don't. We train in adult medicine for 3 years. Yep.
That's great. That, many of us don't have a primary care physician. That we kind of graduate from that pediatrician and go off into the wind and don't find anybody until we wind up with an acute need and then go for it. Why is it important to have a primary care physician?
So the biggest thing is that you have somebody you're plugged in with. So if you do get sick with something, you're not always running to an urgent care or an emergency room. You have somebody to go to when it's simple things like a cold or a cough or you need an antibiotic. It's also nice to have somebody to go to with any other needs you may have, preventive needs. We do physicals. We make sure that we try and catch things before they go on to become big things. And it's very easy. The younger adults always feel, yes, you finish with your pediatrician and you feel like, I'm healthy, I don't need to see a physician. But it helps to come in and have that physical, because sometimes we can catch things before they happen, either a high blood pressure or high cholesterol, something that's found in a blood work that you wouldn't necessarily have had done unless you came in and did that physical. So it's a good idea to have a primary care physician who you can go to with any questions. It's always a starting point, and then have your primary care physician direct you further in terms of whether you need a specialist or whether it's something they can handle right there in the office for you.
Kind of look at a primary care sort of as the captain of your medical team, especially
Absolutely, yeah.
as you go forward in age, and if you're somebody with a chronic condition, you mentioned high blood pressure, that needs to manage.
Exactly.
And and hopefully as you stay healthy, that the captain of the team doesn't need to yell at the recruits too much.
Right.
Tell me a little bit, if I were going to become a patient with you today, what would I need to do? What might be some of the first steps?
Okay, so first thing is call and make an appointment. Usually when you come in as a new patient, we'll have somebody take you back and go over your entire history. The goal of primary care is to get to know you and to get to know your whole history. So once you come in, we get that history from you. The doctor comes and goes over it all with you: medications, past medical history, family history of anything that'll raise red flags in our minds as to would you be at risk for something that we should be screening for? Would you be at risk for some other things that we can check with lab work? That kind of thing. And then once you've done that, then we go over the visit. So if you've come in for an acute visit, we go through whatever you've come in for, try and assess things further, and then decide where to proceed from there. If it's a physical, it's usually a preventive visit. So if you have had all your preventive things, we tell you when you're due for them next. If you haven't had them yet, that's the time to do it, is your preventive visit.
I think the key word there you said is that you're there to get to know us and build that relationship.
Yep.
Because I think that's critical, and that's what makes a primary care physician so important to a family, is if you get to grow with them and they grow with you a little bit.
Exactly, and it's nice because our goal is to get to know you, and then as we send you off to other people, if you need to go to other people, then while they're taking care of their end, you can always come back to the primary care physician to try and coordinate other things if other things need to happen. But yes, we try and get to know you as a whole, your entire history, not just one portion of the history that the specialists may deal with, and that way we get to keep everything under one chart and get to know everything that's going on.
Awesome. Well, thanks for taking time. Appreciate it. It was so nice to meet you.
Thank you.